There's a silent, essential nutrient at work inside you right now. It's not one you hear about every day, but without it, the very blueprint of your body, your DNA, can't be synthesized correctly. Your red blood cells would grow large and dysfunctional, unable to carry oxygen, and the protective sheath around your nerves would begin to fray, leading to irreversible damage. This nutrient is vitamin B12. Also known as cobalamin, B12 is a water-soluble vitamin that acts as a critical cofactor in some of the most fundamental processes in your body. It helps create red blood cells, builds your DNA, and is indispensable for the proper functioning of your entire central nervous system. It even helps convert the food you eat into energy and may play a role in producing serotonin, influencing your mood. So, how much do you need? When a doctor checks your B12 levels, they're looking at a blood test measured in picograms per milliliter or picograms per ml. While the exact normal range can vary by lab, a level above 250 picograms per milliliter is generally considered healthy for an adult. Anything below 200 picograms per milliliter usually signals a deficiency. But there's a large gray area, typically between 200 and 300 picograms per milliliter, that's considered borderline. And many experts now argue that what's considered normal might not be optimal. For long-term health and peak cellular function, some suggest aiming for the upper end of that normal range. For older adults who naturally absorb less B12, an ideal level might be closer to 300 to 350 picograms per milliliter to stay resilient. A deficiency doesn't happen overnight. The body is smart. It stores a significant amount of B12, so it can take years for symptoms to appear after something goes wrong. And what goes wrong usually falls into two categories. First, and most simply, is diet. B12 is found almost exclusively in animal products, meat, fish, eggs, and dairy. This means individuals on strict vegetarian or vegan diets are at high risk if they aren't diligent about consuming fortified foods or supplements. The second, more common cause is malabsorption. Your body can't absorb the B12 it gets. This is the root of a condition called pernicious anemia, an autoimmune disorder where your own immune system attacks the cells in your stomach that produce a protein called intrinsic factor. Without intrinsic factor, B12 simply can't be absorbed in the small intestine. Other issues can also sabotage absorption. Chronic inflammation of the stomach lining, called gastritis, the natural decline in stomach acid as we age, and even certain medications like metformin for diabetes or common acid reducers. Gastrointestinal surgeries like a gastric bypass can also physically remove or bypass the very parts of your digestive system needed to get B12 into your bloodstream. The consequences of this deficiency can be subtle at first, then devastating. The symptoms often masquerade as other conditions, making it hard to diagnose. One of the classic signs is a blood disorder called megaloblastic anemia. The body starts producing abnormally large, immature red blood cells that can't do their job. This leads to profound fatigue, weakness, pale skin, dizziness, and a rapid heartbeat as your body struggles to get oxygen where it needs to go. But the most alarming symptoms are neurological, and they can occur even without any signs of anemia. Nerve damage begins with a telltale numbness or a pins and needles sensation in your hands and feet. This can progress to difficulty walking, staggering, and a loss of physical coordination. Muscle weakness can set in. The damage can even affect your mind, causing memory loss, brain fog, irritability, confusion, and depression. In severe, untreated cases, it can lead to psychosis and a decline in mental abilities that mimics dementia. And here's the most critical part. If these neurological problems are left untreated for too long, they can become permanent. Other signs can show up throughout the body. A sore, red, swollen tongue, known as glossitis, is a common symptom. You might experience nausea, a poor appetite, or weight loss. Your skin and eyes can take on a yellowish tinge from jaundice. It can even cause temporary infertility.
For pregnant women, a deficiency is especially dangerous, increasing the risk of serious birth defects like spina bifida in their baby. Because the stakes are so high, diagnosis is key. It usually starts with a simple blood test for total serum B12. But since this test measures both active and inactive forms of the vitamin, a more accurate picture comes from functional tests. A test for methylmalonic acid, or MMA, is considered one of the most reliable. MMA levels rise when your cells are starved for B12, providing a clear signal of a true deficiency. Once diagnosed, the treatment is straightforward: replenishing your B12 stores. For most people, high-dose oral supplements, around 1,000 to 2,000 micrograms daily, are just as effective as injections. They're easier, more comfortable, and cheaper. However, in cases of severe malabsorption, like pernicious anemia, or when there are serious neurological symptoms, injections are necessary. They bypass the digestive system entirely, delivering B12 directly into the bloodstream for a rapid response. And our understanding of B12 is still evolving. Recent research is revealing that its role is even broader than we thought, influencing everything from muscle metabolism and aging to disease prevention. Scientists are now developing more sustainable ways to produce B12, moving away from methods that require cyanide and the heavy metal cobalt. The relationship between B12 and cancer is also proving to be complex. While low levels can damage DNA and potentially increase risk, doctors have noticed that very high B12 levels can sometimes serve as a marker for the presence of certain cancers, not as a cause, but as a consequence of the disease itself. Perhaps most exciting, researchers have discovered that B12 can significantly boost the efficiency of cellular reprogramming, holding incredible promise for the future of regenerative medicine. Vitamin B12 is a powerful reminder that our health often depends on tiny, invisible components working in concert. A deficiency can quietly unravel the very systems that keep us moving, thinking, and living. But with awareness of the risks, and understanding of the symptoms, and access to simple treatments, it's a condition that is entirely preventable and manageable. It's about listening to your body, understanding what it needs, and ensuring that this vital engine of life never runs low on fuel.